So today we will do the cervical lymph nodes. So cervical group of the lymph nodes today we will do. Now there are about 400 to 450 lymph nodes in the whole of the human body. Out of these, 70% they are present in the head and neck region. So they are called the cervical lymph nodes. And these cervical lymph nodes, they are present in the head area plus the neck area. And we divide these lymph nodes into two groups. One is the superficial group, superficial cervical lymph nodes, and other is the deep cervical lymph nodes. And the superficial cervical lymph nodes and the deep cervical lymph nodes, they form the two circles actually. One is called the inner circle and one is the outer circle. The outer circle, which is so formed, is present at the junction of the head and the neck region. That is where our face ends. So above this line or the lower part of the mandible, everything above is the upper part of the cervical group of the lymph nodes, and they belong to the outer group or the outer circle of the lymph nodes. While the inner circle, they are present deep inside the structures, that is the around the windpipe, that is the trachea, and the food pipe, that is the esophagus. So above the esophagus and the trachea is the upper group of the deep circle, and below is the lower group of the deep circles. So first of all, we will take the outer ring of the or outer circle of the lymph nodes, which are present at the junction of the neck and the head. The name of these inner circle or the ring of the lymph nodes, they are the submental group, then comes the submandibular group, then comes the buccal group, then comes the parotid group, then comes the pre-auricular, then comes the post-auricular, which is also called the mastoid group, and then the occipital group of the lymph nodes. So these are present at the junction of the head and the neck region. So we will take one by one. So this is the lower border of the mandible, this is the angle of the mandible, this is the posterior border of the ramus of the mandible, this is the head of the mandible, and this is the TM joint, the styloid process, and this is the mastoid process, and this is the occipital bone or the occipital region of the skull. And here lies the upper and lower eyelid with the eye. The nose and the upper lip and lower lip. And here lies the mental foramen. And here lies the infraorbital foramen. So first is the submental. As the name suggests, submental lymph nodes, they are present. They are 3 and 4 in number. They are present just below the chin. And they lie on a muscle that is called the mylohyoid muscle. And in between the two bellies of the anterior belly of the digastric muscle. So this is the submental group. The submental group receives its afferents from the tip of the tongue, then it receives the lymph afferent from the central part of the lower lip, then it receives the lymph from the labial and the lingual gums of the lower incisors teeth, so it got the afferent from a wedge-shaped area of the lower part. A wedge-shaped area is the part of the afferent of the submental lymph nodes. Plus it also receives the afferent from the floor of the buccal cavity. So floor of the buccal cavity, central part of the lower lip, gums which are labial and lingual of the incisor in relation to this incisor. So this wedge-shaped area is so formed, if we see from the front side, so from the central part of the lower lip and the floor of the mouth and the incisor teeth inside and the floor of the mouth. This much area, wedge-shaped area, is the submental group of the lymph nodes, which lies medial to the two bellies of the anterior belly of the digastric muscle, and there overlies the mylohyoid muscle, which also forms the diaphragm of the oral cavity, and it is related to the floor of the oral cavity. So that is the drainage area of the submental afferents. Then from here, the efferents from the submental group will go to the submandibular lymph nodes. That is the next group, the submandibular group of the lymph node. The submandibular group of the lymph node, they lies in the digastric triangle, which is formed by the posterior belly of the digastric muscle and the lower part of the mandible. So there are 3 and 4 numbers of the submandibular lymph nodes. And these lymph nodes, they are present in relation to the submandibular salivary gland. As we know, the submandibular salivary gland lies in the submandibular fossa, which is present medial to the body of the mandible, just near the angle of the mandible. So one lymph node is present on the surface of the anterior part of the anterior deep part of the submandibular gland, and as we know, the submandibular lymph node, it is intimately in contact with the S-shaped course of the facial artery, which enters into the from the neck into the face, crossing the mandible, lower border of the or the base of the mandible, then this facial artery, which is tortuous, it goes up, giving branches, various branches to the face, and it ends near the medial canthus or the medial part of the eye, giving the lateral nasal branches, superior labial branches, the inferior labial branches, and the marginal mandibular branches. So this tortuous facial artery has got the intimate relation to the superficial part of the submandibular lymph node. So one lymph node is present in front and one is behind the facial artery, and one is anterior to the facial artery. So there are 3 and 4 submandibular group of the lymph nodes. These submandibular group of the lymph nodes, they receive the afferents, number 1 from the submental group of the lymph nodes, plus they receive the lymph from the central part of the forehead and the medial canthus or the medial angle of the eye area, plus the external area of the nose, side of the nose. Then it also receives the lymph from the cheek area and the upper eyelid area also, and also from the whole of the upper lip, but the lateral part of the lower lip, and the area over the chin also. So again, it is covering a wedge-shaped area of the face, that is the drainage afferent of the submandibular group of the lymph nodes. That is the central part of the forehead, medial angle of the eye, upper eyelid of the eye, the cheek area, the nose area, the upper lip, and the lateral part of the lower lip. So from this area, the lymph reaches the submandibular group of the lymph nodes, which are present on the submandibular lymph node, salivary gland, in relation to the facial artery, as it is having a S-shaped sinuous course with this. So again, the submandibular group of the lymph node, it is also receiving the lymph from a wedge-shaped area. So this wedge is drainage area or the afferents of the submandibular group of the lymph nodes, wedge-shaped area. This was also wedge-shaped. Then the third group is the buccal group. As the name suggests, the buccal group is related to the angle of the mouth, that is the area over the buccinator muscle. So as you know, the buccinator muscle lies over the angle of the area. So this is the buccal line. So the buccal group of the lymph nodes, they are present along the buccal branch of the facial nerve, and they are 1 or 2 in number. And this buccal group of the lymph node, it is receiving the afferents from lower eyelid area, from the cheek, then from the frontal sinus, from the maxillary sinus, and anterior and the middle ethmoidal sinus is the drainage area of the buccal group of the lymph nodes. So lymph so collected from here, it ultimately goes to the submandibular group of the lymph nodes and the cheek area also. So this is how the buccal group also receive the almost whole of the face as well as the paranasal sinuses also. The next group is the parotid group. As it is named, parotid group lies in relation to the parotid gland. So there are also 1 or 2 or 3 lymph nodes in number. The superficial lymph nodes, they lie on the superficial surface of the parotid gland in the superficial fascia, while the deep parotid group lies deep embedded in the tissue of the parotid gland. So again, the lymph nodes, they are present superficially and deep inside the parotid gland. And these parotid gland of the lymph nodes, the afferents of these lymph group comes from the skin of the forehead, the upper part of the forehead, then the area of the temporal region it receives, then the posterior ethmoidal air sinus, is the draining afferents coming to the superficial and the deep parotid lymph nodes. And these lymph nodes, they also go into the submandibular and the deep part of the lymph nodes of the part. Then comes the pre-auricular group of the lymph nodes. So pre-auricular group of the lymph nodes, as the name suggests, they lie in front of the external ear or the pinna. So this lymph node lies in front of the tragus of the ear. The afferent of this lymph node, the pre-auricular, is from the upper part of the outer surface of the skin of the ear plus anterior wall of the auditory canal. Anterior wall of the auditory canal, that is the external acoustic meatus present here. So from its anterior wall, the afferent go to the pre-auricular lymph nodes. Then post-auricular group. Post-auricular group is also called the mastoid group. So behind the auricle, so this is the mastoid process. So a few lymph nodes are present here. So this mastoid group of the lymph node, it receives the afferents from the scalp of the surrounding area and the cranial surface of the skin of the external ear. The medial or the cranial surface of the skin of the ear is the drainage area. And the scalp, the posterior part of the scalp. Plus it also receives the afferent from the posterior wall of the auditory canal. Anterior wall by the pre-auricular and posterior wall is from the mastoid group. So that is how the drainage area of the lymph nodes of the face area comes from. So this is called the mastoid group. And as we know, the sternocleidomastoid muscle is also inserted over the mastoid region. Sternocleidomastoid group. So this is sternocleidomastoid muscle. So the mastoid group is also related to the lymph node of the overlies the upper part of the sternocleidomastoid muscle. So these lymph nodes, they are present in the mastoid over the upper part of the sternocleidomastoid muscle. Then comes the occipital group. So as the name suggests, occipital group is related to the occipital bone. And here lies the external occipital protuberance. From here lies the superior nuchal line where the sternocleidomastoid is inserted, then inferior nuchal line. And here lies a tortuous artery of the scalp, that is the occipital artery. So these lymph nodes, they are present in relation to the occipital artery or the occipital bone. And these lymph nodes, they are present between the posterior border of the sternocleidomastoid and the anterior border of the trapezius muscle. As the trapezius muscle takes origin from the medial 1/3 of the superior knuckle line. So anterior border of the trapezius and posterior border of the sternocleidomastoid. So this is the occipital group. So it is also in the upper part of the posterior triangle. So this is the area of the posterior triangle, the upper part. And these occipital group of the lymph node, the drainage area, the afferent comes from posterior part of the scalp. So posterior part of the scalp is the main coverage area of the backside area of the occipital group of the lymph nodes. Then from here, the lymph nodes, they go along the posterior border of the posterior triangle along the trapezius muscle. And from here, these lymph nodes, they go into the deep cervical group of the lymph node. So that is the efferent goes to the deep cervical lymph nodes, that is the jugulodigastric or jugulo-omohyoid group of the lymph nodes. So that is how we see the whole of the area of the face and the scalp, that is above the mandibular area, is drained by these 7 groups of the lymph nodes, we know. Besides this, there also lies the anterior cervical group of the lymph nodes, which are also superficial, but they are in the neck region. And out of this, one is lying along the anterior jugular veins in the anterior triangle. So they are along the anterior jugular vein. And these lymph nodes, they are called the anterior cervical group of the lymph nodes. Similarly, there is a posterior cervical group of the lymph nodes. Posterior cervical lymph nodes. So they are mainly in the posterior triangle, and these lymph nodes, they are present along the external jugular vein in the superficial fascia. So it is the superficial group, the posterior cervical group of the lymph nodes. So they are present along the external jugular vein. External jugular vein. And they have got the afferents from the occipital group also, and from the mastoid group of the lymph nodes. And their efferents, they may go to the supraclavicular lymph nodes. Supraclavicular group of the lymph nodes, which are lymph nodes which are present in relation to the subclavian artery or the brachial plexus, which are present in the lower part of the contents of the posterior triangle. So these lymph nodes, they receive the lymph nodes from the occipital group also, and from the posterior cervical group also. And these lymph nodes around the subclavian artery and the brachial plexus, which are present in the lower part of the content of the posterior triangle, they are also called the supraclavicular group of the lymph nodes. So this is the clavicle. So they are lying above the clavicle, so they are the supraclavicular lymph nodes. So this is how we do the superficial group of the lymph node of the face as well as in the neck region. They form an outer circle. Now come the deep group of the lymph nodes. In the deep cervical group of the lymph nodes, they again form the 2 rings. One is the inner, other is the outer ring. So the outer ring is formed by the two types of the lymph nodes. One is called the jugulo-digastric and other is called the jugulo-omohyoid group. Jugulo-digastric, as its name suggests, this group of the lymph node, they lie in the carotid sheath in a relation to internal jugular vein, which is overlapped by the sternocleidomastoid muscle. Internal jugular vein. So the jugulo-digastric group of the lymph node is present in a triangle formed by the internal jugular vein, posterior belly of the digastric muscle, and the facial vein, which is coming and it is opening into the internal jugular vein. So this small triangle is so formed, is called the, and here lies the jugulo-digastric group of the lymph node embedded in the carotid sheath, where the internal jugular vein along with the carotid artery and the vagus nerve lies. So vagus nerve lies just medial to the internal jugular vein, and medial to this lies the common carotid artery. So all these three structures, they are wrapped in a sheath, which is called the carotid sheath. Carotid sheath. So this jugulo-digastric group is this is the lymph node of the palatine tonsil. But beside the tonsil, it also receives the afferents from, as we have seen, the submandibular group, from the mouth, deep part, the tonsil, the palatine tonsil it receives. Plus it also receives the afferents from the posterior 1/3 of the tongue also. Posterior 1/3 of the tongue, which is supplied by the glossopharyngeal nerve. So it also receives the, because tonsils and the posterior part of the posterior 1/3 of the tongue is very, very near to it. So tonsillar fossa and the posterior 1/3 of the tongue is the drainage area beside the facial vein, and the lymph node around the facial vein, they are also the afferents of the jugulo-digastric, and the submandibular group is also the afferent of this group. So a wide area is drained by the jugulo-digastric lymph nodes. And jugulo-omohyoid group. As the name suggests, jugulo-omohyoid group, they lie in relation to the omohyoid muscle. As you know, the omohyoid muscle is attached to the hyoid bone, and it has got the intermediate tendon which crosses the anterior triangle, and this intermediate tendon is here. So jugulo-omohyoid group lies just above the intermediate tendon of the omohyoid group, omohyoid muscle, and the internal jugular vein. So somewhere here in the anterior triangle lies the jugulo-omohyoid group of the lymph nodes. The angle between the intermediate tendon of the omohyoid and the internal jugular vein. So here lies this group. This is called the jugulo-omohyoid group. This is a deep group of the cervical lymph nodes. And the afferents of this, so jugulo-omohyoid is mainly called the lymph nodes of the tongue, because The afferent of this comes from the anterior 2/3 of the tongue. Anterior 2/3 of the tongue receive the afferents of this group. Mainly anterior 2/3. Beside this jugulo-omohyoid group also receive the lymph node from the occipital and the mastoid regions also. And they also receive from the larynx also. Pre-laryngeal lymph nodes. They also got the afferents from the peri and the paratracheal lymph nodes also. Because of its anatomical position, so it receives a wide area of the afferents, the jugulo-omohyoid group. So in this way, this is the outer type of the outer circle of the deep cervical lymph node. The inner circle or the innermost circle, we can say, of the lymph nodes of this cervical group, they are called Waldeyer's ring. So Waldeyer's ring is a ring which is formed by the various lymphatic tissue collection in the submucosa, region. The lymph nodes which form the Waldeyer group of the lymph nodes, they are, number one is the lingual tonsil in the substance of the tongue. Lingual tonsil. Then palatine tonsil. Palatine tonsil. Then tubal tonsil. Tubal tonsils are in relation to the Eustachian tube opening in the nasopharynx. Then retropharyngeal, or more specifically nasopharyngeal tonsils. So these groups, 4 on the right side and 4 on the left side, they together constitute the Waldeyer's ring. So they receive the lymph from the different areas. For example, from the tongue, then from the palatine tonsil, and near the palatine tonsil there lies the palate also. And in the tubal tonsil, lymph nodes of the tubal tonsil, they receive the lymph afferents from the Eustachian tube, from the tympanic cavity, and from the posterior part of the nasal cavity. And the nasopharyngeal tonsils, they are present in the posterior part of the nasal cavity, in the upper part of the pharynx, the roof and the floor, junction of the roof and floor. Here lies the lymph node that is called the nasopharyngeal lymph nodes, whose applied is adenoids. So this nasopharyngeal group of the lymph node, it receives the afferents from the posterior part of the nasal cavity, then from the tympanic membrane, then from the sphenoidal air sinus, then it receives from the Eustachian tube also. So from this wide area of the nose, the internal ear, the external ear area, So afferents, they are collected in the nasopharyngeal group of the lymph nodes along with the sphenoidal air sinus also. Sphenoidal air sinus also. So this wide variety is collected in the Waldear's ring, which is the deep inner circle or the ring of the cervical group of the lymph nodes. So in this way we see that from the nasopharyngeal also and retropharyngeal group of the lymph nodes which receive the lymphatics in the pharynx part also, that the nasopharynx, oropharynx and the laryngopharynx if we say. So from the pharyngeal area, the lymphatics, they go to the retropharyngeal group of the lymph nodes which are present in the posterior wall of the pharynx. And from the nasopharynx and from the oro and the laryngopharynx. So every part of this pharyngeal lymph nodes, afferents, ultimately they go into the jugulodigastric as well as the jugulo-omohyoid deep group of the lymph nodes. Beside this, in the superficial group of the lymph nodes of the neck region comes the pre-laryngeal lymph nodes and the pre-tracheal. So upper end of the trachea and the upper end of the esophagus, there are the two openings, that is the GIT opening and the respiratory tract openings are there. So around these openings, that is the respiratory tract and the digestive tract of the GIT, so there lies the lymph nodes all around it. That from the Waldear's ring. So much of the lymph nodes, they are crowded around these two tubes or the two openings of the GIT and the respiratory system. The pretracheal, paratracheal and the laryngeal group of the lymph. So laryngeal group of the lymph nodes, they are present in relation to the larynx, that is the cartilages, between the thyroid cartilage and the cricoid cartilage there is a conus elasticus. So conus elasticus, where lies the laryngeal, pre-laryngeal group of the lymph node, or the conus elasticus. And the pretracheal lymph nodes, so these pretracheal lymph nodes, they lie in front of the trachea, but above the isthmus of the thyroid gland. So the pretracheal lymph nodes, they are present above the isthmus of the thyroid gland and cricoid cartilage. So here lies the pretracheal lymph nodes, while the paratracheal, as the name suggests, paratracheal lymph nodes. So paratracheal lymph nodes, they are present in the tracheo-esophageal group. As we know, there is a esophagus, 25 centimeter long tube. In front of it, there lies the trachea, the windpipe with a C-shaped cartilaginous non-collapsible tube. So in between the esophagus posteriorly and the trachea anteriorly, in between them there is a groove which is called the tracheo-esophageal groove. And this tracheo-esophageal groove contains the recurrent laryngeal nerve branch of the vagus, along with the inferior thyroid vessels. So the lymph node is present along this groove, and it is labeled as paratracheal group of the cervical lymph nodes. So all the lymph from these areas, they ultimately goes to the jugulo-omohyoid group of the lymph nodes which are nearby. So in this way we see that whole of the lymph collected from the head and neck region ultimately reaches the jugulo-digastric and the jugulo-omohyoid, the deep group of the lymph nodes. Now the efferents from these lymph nodes, ultimately they form the right and the left cervical lymphatic channel. On the left side, the channel which is so formed by the union of these lymph nodes, jugulo-digastric and the jugulo-omohyoid, they ultimately drain into the on the left side especially, they open into the junction between the left subclavian vein and the left internal jugular vein. As we know, at the junction or the angle between the left subclavian vein and the left internal jugular vein, here opens the thoracic duct, and the left cervical lymphatic channel, it opens into the thoracic duct here. And here lies a single lymph node that is called the virtuous lymph node. Here lies the virtuous lymph node. And this virtuous lymph node, when it becomes stony hard and enlarged in size, the left supraclavicular is also called right supraclavicular lymph node, because it is present above the clavicle, plus it is also present in relation to the scalenus anterior muscle. So it is also called the scalene group of the lymph node or scalene lymph node in relation to the scalenus anterior muscle. So whenever a patient comes with the stony, hard and large lymph node of the scalene region or the supraclavicular region, it is the diagnostic of the malignancy of the abdominal organ. Because thoracic duct, it drains the abdomen, all organs, so it is diagnostic. Similarly, on the right side, the right lymphatic channel, it opens into the internal jugular vein at the junction of the right subclavian and the right internal jugular vein directly into the vein, because there is no thoracic duct on the right side. So this is how we see whole of the lymph from head and neck region ultimately reaches the deep group, and from deep group it ultimately goes into the venous system. Now last comes the applied anatomy related to these lymph nodes. Most important applied related to the cervical group of the lymph nodes are the lymphoma, that is the Hodgkin and the non-Hodgkin type of the lymphoma, in which patient present with the cervical lymphadenopathy. And various treatments are possible, that is the medical treatment with chemotherapy as well as the radiotherapy also, and other is the surgical removal of the lymph nodes also, and another is the, in order to make the diagnosis, we have to do the biopsy of the lymph nodes in the cervical region also. So while a surgeon is taking the FNAC or excision biopsy of the lymph node, in the cervical region, he or she must know the relation of the superficial and the deep group of the lymph nodes, because both are in relation with the external jugular vein and the internal jugular vein. So a precaution should be taken not to injure these veins. Otherwise, a simple OPD local anesthesia procedure to get the biopsy of these lymph nodes, patient may die sometime if accidentally the veins are cut. Another surgical procedure related to the cervical lymph node is the block dissection of the neck. Block dissection of the neck. This is the surgical procedure usually done in the cancer of the oral cavity or the tongue. So during the CA tongue and the CA of the lips or the oral cavity, we bilaterally remove the lymph nodes of the neck. And this surgical procedure is called the block dissection of the neck. Block dissection of the neck. In the block dissection of the neck operation, we remove the submental, submandibular, the mastoid group, the occipital group of the lymph nodes, anterior jugular group, posterior cervical group of the lymph nodes we remove. But we do not remove the carotids, the vagus nerve, and the veins we do not remove. And the jugulo-digastric and jugulo-omohyoid group lymph nodes, along with the scalene group of the lymph nodes and subclavicular group or the supraclavicular lymph nodes, which is also draining the upper limb, that is the axillary lymph nodes also. So this massive removal of the lymph node are removed to prevent the metastasis from the oral cavity or the tongue going to these areas. So we preserve the vital structures. But in the advanced cases of the cancer spread, we do the radical block dissection. Radical block dissection operation, and this is called the commandos operation. Commandos operation. Especially in the case of the CA tongue, we remove the half of the tongue, that is the hemiglossectomy. Hemiglossectomy. Plus in the commandos operation, we also remove the mandible of the affected side. Half of the mandible is also removed. And we also remove or sacrifice the accessory nerve also, which is traversing the roof of the posterior triangle, coming out of the sternocleidomastoid and entering into the trapezius nerve. So we sacrifice the accessory nerve also here. Plus we also remove the external jugular vein also. So this is called the extensive operation, that is called the commandos operation, to minimize the spread and the metastasis of the cancer of the tongue as well as the oral cavity. That's all about the cervical lymph.